everybody, welcome back to Osteofitness Collective. Today's video is going to be looking at what ankle sprains are, how they present, the main signs and symptoms, the best treatment methods and advice and prognosis. Ankle sprains are defined as a stretch or a tear of the ligaments around the outer side of the ankle. Ankle sprains are defined as a stretch or a tear of the ligaments either on the medial, inner or lateral outer part of the ankle. They have different gradings depending on the severity of the ankle sprain. For example, grade 1 is a mild stretch, grade 2 is a partial rupture of the ligament, and grade 3 results in ultimate instability. The most common signs and symptoms of an ankle sprain are swelling around the ankle, bruising depending on the extent of damage, typically a restriction in terms of range of motion, and pain on walking and instability. It is important that the therapist rules out any type of fracture around the ankle. This is typically using the Ottawa rules. What it looks at is where the tenderness is around the ankle and if the person is able to weight bear. If these are positive, then the person needs to be sent off for an X-ray. The main treatment in the acute phase of an ankle sprain is PRICE, protection, rest, ice, compression and elevation, which we have demonstrated in another video showing ankle sprain treatment. Once the initial acute phase has resolved, it is important that we get movement, strength and stability back into the ankle. Here is a week-by-week guide of what we would recommend. We have also produced a supplementary video demonstrating each of the stages of rehab. It is important after you have recovered from your injury that you are wearing appropriate footwear, supporting the ankle when participating in sport, but also warming up and cooling down appropriately. For more detailed information on this, visit our website or follow the supplementary video showing the treatment.